Hey, hi, thank you so much for listening to this podcast on the Chai or Coffee Show. I'm your host, Vedh, and we have our guest speaker for the day, that is Dr. Nagesh Reddy. There is a lot of outbreak of coronavirus in the world, and the world is facing crisis. There are so many problems and disturbances that is happening in the world, and that's why this podcast we have come up with, which says awareness during the times of COVID-19. People have a misconception that the coronavirus or the COVID-19 is being transferred from animals, especially dogs or the pets that we live around with, to humans. So, just to break this misconception, we have with us today Mr. Nagesh Reddy. Hello, doctor. Thank you so much for being on our show.
Hello, thank you.
Dr. Nagesh Reddy is a founder of the Jiva Pet Hospital, that is a 15-year-old hospital, and they are open 24 hours for the service. Doctor, first thing I would ask you is there is so much of imbalance that is happening. Everybody is quarantined inside their houses. People are literally scared of going out and talking to each other. There is a fear amongst people that this virus is being transferred from animals or the pets to humans.
Yeah,
You being an expert in this stream, what do you have to say? What do you think this is?
yeah. Everyone about that coronavirus, the COVID-19, is a virus which has been originated in China. Okay, in China, in Wuhan, it was originated. Initially, they had a confusion that from where did this virus originate. Till now, they are not able to find out from where it originated. But because Wuhan has got some animal market, they try to figure it out. Then this was confirmed from OIE. OIE is Official International Death Statistics. It is a international organization, like how we have got the World Health Organization. They have, along with China, they have gone and tested the animal samples, and they were not able to check, or they were not able to find any virus, like coronavirus, in the animal samples. So this is an entirely new virus which has been emerged, and so because it was emerged during 2019, it is called as COVID-19. Disease name is COVID-19, but it is affected through a virus called SARS coronavirus 2. The virus name is SARS coronavirus 2, and this particular coronavirus is specific to humans. Means it affects only humans, and it does not affect other animals. And the transmission is from human to human, and it does not transmit from animals to humans.
Okay,
Yeah.
there's this is just a myth that people are saying that this virus is being transmitted from animals to humans.
Yeah, there is no evidence that even the WHO and the OIE, the international organizations, have stated, there in the websites also, that it is not transmitted from animals to humans. It is just a myth. And we found recently in one or two social media that in Hong Kong they found out COVID-19 virus in some dogs. But this particular case was the owner was infected with COVID-19 virus. She was undergoing treatment. During that particular time, they found out some on the skin sample coronavirus COVID-19 disease was seen onto the dog, but there are no symptoms in the dog. The dog did not show any symptoms, or it did not transmit from one dog to the other dog or one dog to the humans. That was confirmed from the organization.
Okay, yeah.
Yeah.
One more thing we would like to know is now
Mm.
there is a lot of disturbance that is there. People are
Mm.
being quarantined. There have been lockdowns that are happened just to
Yeah.
control the virus from spreading.
Yeah.
There are two things that are possible now. One is
Mm.
the trace of virus will totally vanish, as
Mm.
it will become like any other virus that came, and because of our modernization and development in the medicine stream, so the
Yeah.
viruses have, we have antidote and all of that for that.
Mm. Mm.
So
Mm.
there are two possibilities. One is it can totally vanish, or it can be
Mm.
worse.
Yeah.
So what do you see as a after effect, even after everything sets right? What do you think the animal will face, or in terms of
Yes,
social
the
security?
basic idea of the quarantine is to break this chain. Because in humans also it is spreading from one human to other human. It is not spreading through air. It is like a droplet infection. So if you are in quarantine and if you are staying at home, if the chain breaks, then it will not spread from one person to other. Okay. But
Mhm.
in dogs, what I am saying is, because now it is a 3 weeks lockdown. Fortunately, if it closes in 3 weeks, then it's okay. If the same situation continues, I'm worried about the pets. I'm worried about the other animals. Worried about the uh, stray dogs in the roads. So what will happen to those things? That is the main concern.
Yeah,
Yeah.
that is something that we have to really
See,
look.
there is a lockdown now, and some pet shops have closed. What happened to the birds inside? What happens to the animals inside in the pet shops where they were feeding it daily? And how will these pet shop people will go and feed them and open the doors, feed them, and take care of them? That's the main thing.
And
Yeah, yeah,
we are moving back to the last part of our discussion, Doctor. So
yeah,
we are all speaking of social distancing, but
yeah.
your profession, being a veterinary service, is an
Mm-hmm.
essential service for all the pets and all. You can't stop
Yeah,
it like
yeah,
any other medical
yeah,
service that
yeah,
we humans
yeah,
have.
yeah,
So how
yeah.
does social distancing imply in your profession?
See, because it is an essential service, where all veterinarians are providing services. So some people are providing in the government sector, some people are providing in private sector. But you need safety of these veterinary doctors also. So I request each and every human pet parents, whenever they are approaching any veterinary doctor or any human doctor or any other places, uh, just they have to maintain social distancing. They maintain the queue system, and they have to approach the veterinary doctors because it is a safety. They are during this crisis also they are giving treatment, but the people should understand and maintain the social distancing. And while entering, before coming, they can sanitize themselves. They can use masks and they can enter the hospitals. That I request to the pet parents.
And do you think that implies even to other medical procedures which humans go to?
Yeah, yeah. In any medical procedure, if they in any emergencies, if they go to the hospital, better they go and as less people enter the hospital is better. And before going, they can sanitize their hands, try to wear the mask, and be away from the doctors, at least 2 meters away from the doctors, and try to discuss with the doctor.
Because even doctors, what they're doing is a great service. During this time, risking their own lives, they're helping people, they're helping animals. So yeah,
Yeah,
we have come at the end of this discussion. Dr. Nagesh, thank you so much for being on our show and telling people that the virus, that COVID-19 virus, is really not transferred from animals to humans.
yeah.
So
That
we
is
can,
for sure that it is not transfer from animals. So
yeah,
that is all the pet parents should understand about.
yeah. So, people like you, we need more and more knowledge, and we need to listen more and more from people like you because you are the experts, and it's always nice to listen from an authority. So,
Yes.
thank you so much for coming on our show, and to the viewers, thank you for listening to this podcast. Be safe, stay indoor, help these animals who are voiceless. Let's be a voice to them. Thank you so much for listening to this
Yeah.
podcast. See you soon with another podcast. Until then, take care.
Thank you.
Thank you, Doctor.